All right, we are live.
Hey, hi everyone, welcome back to another session with Fresh Dental Shadowing. Today we have Dr. Roth, and he's an oral and maxillofacial pathologist. So yeah, take it away whenever you're ready, doctor.
Perfect. Thank you very much. So as mentioned, my name is Dr. Stephan Roth. I am a diplomate of the American Board of Oral and Maxillofacial Pathology, which just means that I've passed my boards. It's a very fancy title. I am attending at Northwell Health, Long Island Jewish Medical Center. Northwell Health is a very large hospital system here in the New York area and surrounding Westchester County, Nassau County, and Suffolk County, which is Long Island and the area above New York. And then I'm also an adjunct professor at Touro College of Dental Medicine and have done a little bit of clinical work at a local dental hygiene school in Queens. So just an overview of my talk. I'm going to give you a little bit more about my background and how I end up where I am. A little discussion about oral and maxillofacial pathology, because I'm sure many of you may not even know that that was a thing. My journey, and then what my practice is like, and then I'll show you a few fun cases. If you have done any presentations with me before or any shadowing with me before, I do always mix up my cases. So there will be some that may be familiar, and some that will be brand new. So a little bit about my background. I went to The Ohio State University for undergrad, where I got my bachelor's in biology with a pre-dental track. I could not tell you what my academic average or PAT was. I don't remember. So that will show you the things that you're stressing about today in, let's see, 9 years from now. I'm telling you how old I am. They won't matter anymore, but they're important now, but they won't be at some point. So that should hopefully inspire you with some hope. I stayed at Ohio State, where I got my DDS. I did a residency program at this hospital, Northwell Health, Long Island Jewish Medical Center. You may recognize it. It's been on TV in Madam Secretary. It was also featured in an Adam Sandler and Chris Rock movie on Netflix, where Chris Rock's son was marrying Adam Sandler's daughter, and it was really awful. It was not good. Chris Rock was a surgeon in California, and the California hospital was actually LIJ, this hospital where I work. And then, so they did that in my first year of residency. So I got to meet Chris Rock and Adam Sandler in my hospital, my first month of residency. And it was also featured in The Big Sick. And then I was very fortunate to be hired there this past January, and that's where I work now. Just to do a little geography, since I know that the two people on the call now are West Coast, but this is New York City. New York City is comprised of 5 boroughs: Staten Island, the Forgotten Borough, Manhattan, which a lot of people associate with New York City, the Bronx, Brooklyn, and Queens. My hospital is right here on the border of Queens and Long Island. Long Island, further out east, I'm about 2 hours from the Hamptons. So we get a lot of people from a lot of different walks of life, where we get people that drive from the Hamptons to see us, and then we also get a healthy patient population from Brooklyn and Queens and Manhattan. So what is oral and maxillofacial pathology? It's an extremely small specialty of dentistry. There are about 250 or so in the United States practicing, so very, very small. Most of us practice in dental schools. Some, like myself, are in hospitals, and very few, you could probably count them on one or two hands, are in private practice, either seeing patients, looking at microscope slides, or a combination of both. And the purpose of oral and maxillofacial pathology is to diagnose conditions of the oral cavity, both in patients and under the microscope. So we're talking things other than cavities, which are cancer, autoimmune diseases, infections, allergies, and things of that nature. So oral pathologists, really it should be 4 things, but these are kind of the 3 major focuses of our practices. Either teaching, so obviously the people in dental schools spend a significant amount of their time in practice teaching. Microscopy, looking at things under the microscope. This is a dermoid cyst, which is very interesting. It's a cyst that was under the tongue, and this is actually sweat glands and hair follicles that empty into that cyst. And then patient care. So this is a case of histoplasmosis that I saw in the hospital. I probably lie right here on the spectrum, where most of my time is split between looking at microscope slides and patient care with a little bit of teaching, mostly of the residents. This is from my YouTube channel, and then also part-time at the dental school. So how did I get here? This is my free talk right now. So I don't want to discourage anybody. The world needs wonderful general dentists, and I hope that all of you are much more intentional about dental school than I was. A lot of my friends in college were going to medical school, and I didn't want to be part of the crowd, and so I said, I'm going to apply to dental school. I always knew that I wanted to do something in healthcare. Everyone in my family is either a healthcare provider or a teacher, so I have the benefit of kind of being both. I've always been interested in biology, always been interested in human anatomy, so much so that I TA'd it in undergrad. I was a TA for the human anatomy course, and I loved the head and neck. I thought it was very interesting. So I thought, you know what, I'm going to do something different. I really like the head and neck. I like working with my hands, or so I thought. And so I applied to dental school. The only issue was, about one semester in, I found that I hated it. And this is my experience. This is not everybody's experience, but I found that dentistry was not right for me. Dentistry is very artistic. You have to have a very developed artistic side. You have to be very interested in the way things are shaped, in the way things are colored. You have to be very good at internal angles. So hopefully you're liking all the PAT studying. And it was something that I really struggled with, and something that was not making me happy. And I didn't want to be in a career where I wasn't going to enjoy it. And so I strongly considered dropping out of dental school and applying to medical school. Dental school is very similar to undergrad in that there are a lot of student organizations. So there's a student organization at Ohio State and many other colleges called the Association of Women Dentists. And I was not a part of that group, as I am not a woman, but they had a specialty series where all of the program directors from the specialty residencies came and spoke different months out of the year. So I saw that the director of the pathology program was speaking, and I thought that might be interesting. So I went and listened and really enjoyed it. So I asked to shadow him, and I did, and he ended up setting me up with another pathologist there that became my mentor, and I shadowed weekly. And from that point on, I had my head down, and I knew that pathology was exactly what I wanted to do. And so I've never looked back, and I'm so very happy. So I guess this all goes to say that, you may have a plan as to what your future might look like. If I was sitting on this call, there would be no way that I would think that I would be sitting in New York after doing this residency program and doing what I do daily. I didn't even know that this career existed. So I really encourage you. I plan to go to dental school and become an orthodontist. And that was like my goal. Little did I know, I hated dentistry, and then my first orthodontist course I hated as well. So that went out the window. And I'm telling this not to discourage you, but to let you know that it's okay to change course. It's okay to deviate from your plan. It's okay to reevaluate. And that's really, really important because you want to be happy. So in dental school, if you find that you really gravitate towards one subject over another, then pursue it. See if you can shadow more and learn about different specialties. If you love general dentistry, then pursue it. If you have the dream of opening your own practice and you go into dental school and you kind of deviate and you want to join a group, then just follow it. Just know that it's good to have direction, but it's also good to reevaluate and to adjust as needed. And there's nothing wrong with struggling. It happens to everybody, and there's nothing wrong with failing. That's how you best succeed. And so that's kind of how I ended up getting to where I am today. So that was kind of a digression, and hopefully not too depressing. It has a happy ending. So I'll go over a few cases with you. These are cases that either I saw or were sent by oral surgeons that sent their biopsy specimen. And so I have a few good stories. So this first case is featured on my YouTube channel, and it is from a local oral surgery program on Long Island. They had a Hispanic male that recently immigrated to the United States report with a swelling of the left upper lip. So here we have the photographs of the patient. And if you look at the middle of this patient's lips, you can really see that the left side of the patient's face is different than the right side. There's definitely asymmetry here. And when you pull back the lip, you can see this kind of bump. And this is not uncommon. We see a lot of things like this. There are a lot of common things that can look like this. But on biopsy, this is in the formalin, which is what biopsies go into. They saw this very interesting red-looking thing with this red line down the middle. And that red line is actually a notochord. Under the microscope, we see this really thick cyst lining. And then if we look closer, we can see this kind of really pink, kind of loop-de-loop looking structure. I'll annotate right here with all of these kind of loops. This is actually intestinal mucosa inside of this patient's lip. So what was going on with this patient? This patient had something called cysticercosis, and that is a tapeworm. So most patients most people in developed nations get tapeworm by eating undercooked pork or other meat, where the pork has ingested from a contaminated water source the eggs, which hatched and then traveled to the muscle, which then gets eaten by the person, and then the adult tapeworm kind of forms in the intestines. Well, in this case, this patient was immigrating from a developing nation. The patient drank from a contaminated water source and ingested the eggs and essentially became like the pig, where the eggs kind of hatched and went into the patient's muscles of the upper lip and kind of formed there, waiting to be biopsied. And cysticercosis can be very significant in developed nations. It can happen in the eyes. If you're feeling very adventurous, you can Google neurocysticercosis, and that is where these travel to the brain, and it looks like Swiss cheese because it's all of these tapeworm larvae that are present in the brain of these patients. So this is my second case, and this is a case that I actually saw. This is a 70-year-old female who was admitted to the hospital because she had a very difficult time eating and drinking. And you can appreciate that the mucosa is very red, and if you rubbed it, it actually just peeled right off. And so you can see the stitch here, that's from my biopsy. So I performed the biopsy on this patient to look at it under the microscope. And normally when we look at mucosa, the lining of the mouth under the microscope, we can kind of look at it from top to bottom and it's all connected. The problem here is that the bottom is still attached, but the top is kind of ripped away. So we have a special test called direct immunofluorescence that allows us to label antibodies. So there are diseases, autoimmune diseases are essentially when our body creates antibodies that attack our own cells. And we know with COVID, all of these discussions of antibodies are good. We want antibodies to fight off invaders, bacteria, and viruses. We get autoimmune conditions when these antibodies attack our own cells. And in this condition, which is called pemphigus vulgaris, the patient produces antibodies that attacks the lining of their mouth, and it just kind of peels away. And it's incredibly painful for these patients. So we can label those antibodies to essentially glow in the dark, and we can see where all of this green is. That's where the patient's antibodies are attacking the cells. And that's a very special test that we do. So this is pemphigus vulgaris. I mentioned it's an autoimmune condition, and it can also affect the skin, it can affect the eyes, it can affect the genital mucosa, the anal mucosa, and it's pretty excruciating. In fact, most of these patients before the invention of steroids died from malnutrition or from infection from losing so much of their skin and mucosa. This is the patient about a month after high-dose steroids, completely back to normal. So that's really great for these patients that we are able to treat them and make them better. And then finally, this is my last case for you. I'm going through pretty quickly, so hopefully there's a lot of questions or you'll have a short session tonight. But this is a 75-year-old female that had a 1-year history of a slowly expanding mass of the alveolus. And the alveolus is the bone that holds all of the teeth. So here we have our clinical picture where we can see this is normal and this is normal, but we have this huge bulge on both sides of the alveolus, which holds the teeth, and it's even tipping these two teeth towards each other. When we look on the x-ray, we can really appreciate that all of the normal bone's okay, but we have all of this space where there's this tumor growing. And under the microscope, this was an ameloblastoma. And ameloblasts are the cells that actually create enamel, the white portion of the outer teeth. So if those cells go bad and create a tumor, it's called an ameloblastoma. This is benign, so it's not cancer, but it can be really aggressive. These can grow really impressively large if they're not taken care of. This is the most common tumor of the teeth, but it's still very rare. We see maybe 5 to 10 of these a year, and we see about 10 to 12,000 biopsies. They are slow growing, but in the maxilla, they can be more aggressive because the maxilla has more space in the bone and is close to the sinus. And in fact, some patients with maxillary ameloblastomas can die because the tumor gets so big that it presses on their brain and their brainstem and causes them to die of this disease, even though it's a benign tumor. So with that parting advice, it kind of goes back to my story, and that is to really not be afraid to try new things and change your life direction. That you may have a plan for how you think things are going to go, but it's okay to deviate from that plan in search of fulfillment and happiness. Next is to define your own success, and that's really difficult in the age of social media. I think that there has always existed outside pressure from family and friends to have certain expectations, but now we have the detriment of comparing that to others. So we see other people's filtered life through Instagram and Facebook and TikTok, and we try to aspire to that when that shouldn't be what we aspire to. We should aspire to our own idea of success and our own goals. And then also lean into what you like and what you're good at. Again, if you find that you go to dental school and you really like one aspect of dentistry, that's something that you should really lean into and you should really pursue. Maybe not as a specialty, but as a practice focus. Maybe you love doing root canals, then you should be excellent at doing root canals and really pushing yourself to try new things and to try new treatments and procedures in that area. Same thing with braces and pediatrics. You don't have to specialize, but you can focus on being better at those things that you really enjoy and incorporating that as part of your career and your work-life balance. So that's kind of all I have. I know that was pretty short, but I do have a Instagram that I'm trying to post to relatively frequently, YouTube where I post about once a week, really more informational things. And that is my email address. Should you have any questions for me at any point in time, feel free to reach out. And then these are the fresh dental shadowing emails as well. And with that, I'd be happy to take some questions. Hopefully you have some.
All right, thank you so much, Doctor. That was an awesome presentation. So I think we can get started with the questions now. Let's see. So the first question was, how many years was your residency program? And in terms of schooling, how is an oral and maxillofacial pathologist different than a surgeon? Did you still apply like the 4 and 6 year programs, or just how did that work?
I'm going to shamelessly plug while we do this, if that's okay. So the oral and maxillofacial pathology is completely separate and distinct from oral and maxillofacial surgery. So oral maxillofacial surgery does have a 4 and 6 year track. 4-year track does not have a medical degree, while the 6-year track does. You graduate with a medical degree, but that's completely separate. That is a match program, meaning that in your 3rd or 4th year of dental school, you take this really difficult test called the CBSE, and then you apply to the match program, you go on interviews, and then you rank your choices. The programs rank you, and then they pair you up kind of like matchmaking. I did not apply to oral surgery. I'm a little bit squeamish, to be honest. In dental school, in my 4th year of dental school, I remember that there was an advanced oral surgery lecture course, and they were like showing like degloving procedures where they do coronal incisions and pull the face down, and they're plating, and I like almost passed out in class. So oral surgery is absolutely not for me. I think it's really cool, but I had absolutely no interest in oral surgery. I'm happy to look at people's mouths being cut out of them after it's already done. Send it to me in a bottle. I don't want to see it happen. Oral pathology is a 3-year residency after dental school, and it is not match. It is individual application, so it's kind of like a job where you can apply to as many as you want, and each program has different applications and different things that they want from you. And you interview, and then you can get 1 offer, you can get 10 offers. There's only about 11 programs in the country right now, and most take 1 resident, a few take 2. My program, where I went and now work, takes 2. Did I answer the full question there?
Yeah.
Okay.
So because it was so competitive, what factors did you, or like what kind of things did you do in dental school to stand out as an applicant?
So the interesting thing about oral pathology is that while it is competitive, the pool is also smaller. So it's so different from dentistry that not very many people apply, to be honest. So, there are 11 programs, and for the 11 programs, there might only be 30 applicants, but that's still pretty competitive. That's still only 1 in 3 is going to get a spot, perhaps. The great thing about oral pathology is that it's an extremely small profession. So everybody knows everybody else. We all know everybody else. It's a really great community. We all get along. We have an annual meeting every year where we all get together, and a big part of that is a social event where we get to catch up with old friends, and it's really, really great. It's a very small, very tight-knit community, and so a big part of applications is who's vouching for you. So they are at dental schools. There's at least 1 or 2 at almost every dental school in the United States, and so if you show genuine interest during dental school in the profession, and you have a mentor, the mentor is going to vouch for you and say, this is a real applicant, they're a good person, they're actually interested in the profession, they've done a lot of shadowing with us, they've done projects with us, and just that act of a actual reference. So I'm sure many of you are getting reference letters right now, and I guarantee that a lot of your references have a saved reference that they are plugging your name in and your CV in and signing it. References within our community is a call on the phone where they say, I know this person and they're going to be a great resident or not. So if someone goes to dental school and finds that this is a route that they want to take, then the best thing they can do is, number 1, get good grades in their pathology courses. So to be transparent, I got a B in orthodontics, and then I got C's in my drilling courses. It didn't matter. What mattered was that I got A's in my pathology courses, that I did a ton of shadowing, that I had a mentor. I had several mentors at Ohio State that were pathologists that were able to essentially vouch for me and say that he'll make a great resident. Different. So if you want to go into oral surgery, You gotta have great grades. You gotta have great test scores on the CBSE. You gotta interview well. And for most residencies, it's that way. But oral pathology is so cool in that everybody knows everybody. So if you're interested, then as a dental student, you're probably going to get picked up. In your third year, you're going to start meeting program directors that are going to want to bring you into the program.
Okay, thank you. And then someone asked, what factors should one consider when applying to residency or dental school? And then, how was your experience at Ohio State?
So, residency is completely dependent on the specialty you want to do or the general practice residency that you want to do. I strongly suggest that even if you are interested in doing general dentistry and being a general dentist, that you do a GPR, which is a general practice residency, or an AEGD, which is an advanced education in general dentistry program, because a residency program is truly a unique experience that you don't get in dental school. And so even if you don't want to specialize and you want to do general dentistry, I still recommend doing a residency. I'm not going to talk too much about how to choose a residency, because again, that really comes down to the specialty that you want to do. I will say oral pathology, there are 10 or 11 accredited programs and they're all excellent, but dental school is important. So despite hating dentistry, I did love my time at Ohio State. And one of the things that really saved me was that Ohio State had just about every specialty residency except radiology and public health. So I was able to shadow in all of the specialty clinics. And so that was really great for me because I had an oral pathology residency program that I was already shadowing and almost an honorary member of in dental school. So if you are interested in specializing even initially, or if you are open to it, then I really recommend going to a school that has lots of different, or at least a few different specialty programs, because that will at least expose you to what you're doing. Another important thing is to ask about the clinic structure and ask students about their experience in getting clinical patients. So that can be very difficult, getting clinical requirements, and knowing how that system works is really important. That's a really good question to ask on an interview, is how does the clinic work and how does patient allocation work in the clinic? Because you don't want to go somewhere where it's kind of a free-for-all or there isn't an organized structure. And then lastly, it's a personality thing. I was speaking to our two hosts before the meeting started, and I actually think that despite the traveling and despite the inherent risk of it, I do think that there is a benefit to in-person interviewing. I think understanding the culture, both of the school and of the community, is extremely important. So I would say, if you get invited for a few interviews, maybe go a day early and just kind of check out where it is. So is this a place where you can see yourself living for 4 years? Now, granted, if you are only applying to a few programs and maybe you only have one interview, that's a moot point. But if you're weighing some options, it's really important that the culture of the school is something you want. So the vibe from the students, the vibe from the faculty, maybe talking to a few graduates, and then also the culture of the area. So, is this a place where you can see yourself living for 4 years? Are there things that you like to do in this city? Are you going to be able to continue hobbies or things that allow you to be sane when you're at dental school? So if you really like, skiing, or you really like being in the snow, maybe don't apply to dental schools in Texas and Arizona. If you really like, golfing, then maybe don't apply to a school in the middle of nowhere where the nearest golf course is 3 hours away. So that's things to consider when thinking about a dental school.
Okay. And then have you had any cases where you've had to work with another dental specialist, and what does that process normally look like?
Yeah, so all of the time. The all of our biopsy specimen comes from oral surgeons and periodontists and endodontists and general dentists. So we are constantly communicating with all of the people that are sending biopsy specimen so that they fully understand what we're seeing under the microscope. So our job is essentially to be their guide, to tell them this is what we saw under the microscope. Sometimes they'll call and they'll ask what we think they should do moving forward. What's really cool about where I work is that we have quite a few oral surgeons. So I'll be sitting at my desk and one of the oral surgeons will walk in, knock on the door and be like, hey, I've got this tumor sitting in my chair. Like, can you come look and make sure I get a biopsy where you want it? So I will go into the room, I'll look at a patient with a tumor and watch the surgeon take the biopsy. And I'll tell the surgeon where I think they should take the biopsy. So my job is inherently collaborative. Everything I do is in relation to another specialist or a general dentist, other than maybe seeing patients in my own practice. But our biopsy service is very heavy on working with oral surgeons and periodontists, endodontists, general dentists. And in fact, our new department chair is an oral surgeon, but a MD oral surgeon that went on to do a specialty in head and neck cancer. So he's doing these huge jaw resections that are amazing. And it's been really great to work with him because he's able to talk to us about the surgery, and we're really able to help one another to provide the best care for the patient that had this cancer. So we can help guide the surgery, and then he can help us in guiding us as to how to best evaluate the tissue after he cuts it out.
And then can you walk us through like a typical day as a pathologist, and how many patients do you normally have and what are your hours like?
Yeah, so my day, like I said, with pathology, there are pathologists out there that only do research and they don't see patients, they don't look at slides. There are pathologists out there that only look at slides and don't see patients. There are pathologists out there that only teach. And then there are pathologists that do a combination, and I kind of do a combination. An average day starts with a resident education activity. So we'll do journal clubs where the residents present a journal article. We'll do formal slide teaching. So we get exchange cases, really interesting microscopic cases from other programs. And we go through that with the residents and kind of teach them a little bit more formally on some of the more rare stuff. And that's followed usually by signing out the biopsy specimen that we get in the mail. So we get biopsy specimen from the mail, it gets processed the day before, and then the next day we look at all of the biopsies under the microscope and generate reports. After that, it kind of varies. So some days I see patients one full day and one half day, so 1.5 days of my 5-day week. Sometimes I'm doing administrative stuff, talking to clinicians about their biopsies. Sometimes I am doing teaching. Sometimes I'm lecturing. Sometimes I'm putting together packages to send to our oral surgeons with different stuff that they need. It varies from day to day. My patient days, either the full day or the half day, my new patient exam is about 45 minutes, and the entire time that I'm in the oral cavity is probably 3 minutes. So the vast majority of that 45 minutes is talking to the patient about their medical history, about their chief complaint, and then counseling them on their condition. Sometimes I do a biopsy, sometimes I don't. I don't always need a biopsy with patients. In fact, I'm very rarely doing a biopsy. But the vast majority of my time with the patient is just talking to them. And for most patients, it's telling them that they're going to be okay and that they don't have cancer. The really bad days are when you have to deliver the news or tell someone they have cancer. That's not a good day. But that doesn't happen very, very often. So it varies, and it's always, there's always something weird going on, either with the microscope case or with a patient. It's never boring. There's always something weird, and really enjoy it. And there's also a lot of variety. I don't really get bored It's not like I'm doing the same thing all the time. I'm constantly running around. Sometimes I have to go to the operating room and do look at the microscope while they're doing surgery. So they'll send margins of their surgery, and I'll look at it under the microscope and tell them if they got all the cancer out. So it's a wide variety of things. I don't have kind of a consistent day. I'm kind of all over the place, as was that answer. So I apologize.
No, you're good. And then there's some questions in the YouTube live chat. Somebody asks, do you ever get cases that bother you in terms of blood or anything similar?
So in dental school, I got over my fear of blood pretty quickly because you extract teeth, and that can be pretty bloody. So I can do a tongue biopsy where I cut into somebody's tongue and it bleeds a little bit and it doesn't freak me out. But like if I'm walking and I stub my toe and my toe starts bleeding, like that freaks me out. If I'm with a friend and they like cut their hand, like cannot be bothered, cannot look at it. So I guess it's just like dissociating. I don't really struggle with that. The only things that kind of bother me, not from a blood standpoint, but I really struggle with the cancer conversation. I've had to do it twice now, and telling someone that they have cancer is awful for them, and it's really difficult for the provider as well. Not nearly as difficult, but that's something that I still really struggle with is, having to break this really life-changing news to that person. But as far as the procedures I do, nothing really. There are a few things, that dermoid cyst that I showed you in my triangle. When we get that and we open it up, it looks like a cream puff because it's full of hair and sweat and skin, and it smells awful. It's basically like sweat that emptied in a balloon and it's been sitting there for months. And so that's something that I really don't enjoy, is this really gross cream puppy looking thing that smells like death. But other than that, it's pretty easy.
Okay, and then somebody asked, which aspect of your career switch was the hardest, especially considering how rigorous the dental school process is?
Yeah, so the thing about oral pathology is that, you work 4 years to become a dentist, and then you enter residency and you basically start from scratch. It is so different from general dentistry that, yes, some of the things that you learn in dental school are very helpful, but it's a completely new language. It's a completely new set of skills, and it really takes 3 years to master. So that's really difficult and a little bit discouraging. Like, why did I just put myself through 4 years of dental school to basically start all over again? And the reason is because dentistry wasn't making me happy. I knew that this would, and it does, but it was very challenging. There's a steep learning curve, and it really does take 3 years to kind of get on top of it and to continue learning. There are things that I'm learning every day, from reading the literature and reading articles and working up cases. But that's probably the most difficult thing, especially with how difficult and rigorous dental school is to really start all over again after putting in all of that work.
And then someone asked, do you need a master's degree in your specialty or just a residency? Or do you think there's any benefit in doing a master's degree?
That's a great question. So a lot of the residency programs that are based out of a dental school do offer a master's degree. In fact, most do require a master's degree. Some dental schools do want to see the master's. I do not have a master's. I have a certificate, which means I graduated from the program, and then also I'm boarded. So I did take the boards and pass. What's more important than the master's is taking the board exam and passing it. There are some dental schools that would prefer that people have their master's, but the reputation of the program is also important, as is who you know, how you were as a resident, what your recommendations are like, what your skills are like, and if your vision aligns with the job. So a master's is not required. It may or may not be helpful. I don't have a master's, and I'm doing A-okay. But there are some situations where maybe someone would want to pursue a master's in oral pathology.
Okay. And then somebody asked, what activities did you do during undergrad? I'm assuming like they mean to get ready for dental school. Or
yeah. So I'm surprised that I didn't go more into this. Perhaps this is why I didn't like dentistry. I really did not do a lot pre-dental stuff. So my thought was undergrad was really a chance for me to discover myself. So I did a lot of things to develop my leadership skills. I was in a fraternity. I was involved with Relay for Life because cancer awareness was really important to me then, as it is now. I was really involved in a lot of leadership groups, facilitating leadership retreats and activities. I was on homecoming court at Ohio State as pictured. And I took a lot of interesting classes like badminton and whitewater rafting and history of the 60s. And I did all of this because there were things I wanted to do. There were things I wanted to explore. There were things I wanted to learn. The thing I'd caution you against is you don't want to have your blinders on in undergrad. You don't want to only have dental experience. Like if all of your extracurricular activities are only dental focused, that's okay. But a lot of dental schools really want well-rounded people. So they want you to have interests outside of dentistry. And undergrad is really the only time in your life where you have kind of the freedom and the opportunity to do a lot of exploration, to try new things, to try new groups, to be involved with different activities, to take different classes. And so that to me is my biggest, is another piece of advice, is try to get out of the dental bubble. There are people that only shadowed, only worked at a dental office, only involved in pre-dental club, and that's it. And I think that that's kind of a shame. That's kind of missing out on some of the opportunities that undergrad offers to really explore different interests and to become a well-rounded person. That being said, I probably should have shadowed more in undergrad to really figure out what I wanted to do. But I do not regret any of my time in undergrad. I miss my time in undergrad. I feel like I'm in Billy Madison, like, never leave, don't leave. It really is wonderful. So that's my big advice is yes, you got to get good grades. You got to do well in DAT. Got to have shadow hours. You have to have some interest, but really try to take advantage of all of the other opportunities as well.
And then somebody said, how do you suggest is the best way to ask to shadow a dentist?
Yeah, so that's really tough right now with everything going on. The best way is to leverage your relationships. So if you have a dentist that you have went to or worked with, then leverage that and ask to shadow. If you are away from home and away from your family, then leverage your friends' relationships. If you have friends that are applying to dental school, ask who they're shadowing and see if the practice that is allowing your friends to shadow will allow you to shadow as well. If they're already allowing shadows, then they'll probably allow you to shadow too. The other great resource is if you are close to a dental school, ask to shadow some of the faculty at the dental school. They will definitely be open to it, even if you cold email them, unless they suck and unless they're really mean faculty. But that will also help you figure out that that's a dental school you don't want to go to. But if you're near a dental school, go to the faculty website and email them. They're used to having students and they are probably going to be great shadows because they'll talk to you. And then also it may be a great letter of recommendation and also a great way into the dental school if you're already shadowing and familiar with some of the faculty.
Okay, and then somebody said, how many courses do you take per semester in dental school?
Yeah, so that varies based on several things. The first being the year, and the second being the dental school. So for me, my first year of dental school, there were probably 5 or 6 classes a semester. Second year, 6 to 8. And then third year, we started seeing patients. So we would have maybe 3 or 4 different classes on top of going to clinic. So we would have a class in the morning and then go to clinic in the morning and clinic in the afternoon. So it really depends on the year, the semester, and the school. It really varies. In fact, a lot of schools, if you go to their website, they have sample curriculum. So you may be able to see what classes are like each semester. And a lot of times if you're going on interviews, that's a good question to ask. And a lot of dental schools do have information and graphics to help you kind of see what the course load is like.
Okay. And then how did you go about managing your time, like in dental school and residency? Yeah, like imagine it'd be really busy.
So in dental school, it's a little bit more difficult to manage my time. Residency was a breeze. If I could be a resident, I'd be a resident forever, because I had a 7:30 to 4:30 every single day. Showed up at 7:30, left at 4:30. Didn't have to do anything when I was at home. There were only 6 days in the 3 years when I had to stay after 4:30 to do something. It was awesome. So most of my residency was, taking advantage of that free time, working out, going into New York City, which was new to me. It really was not a lot of outside work. As far as dental school, my biggest advice for that is figure out how you study most effectively now. So for me, in undergrad, I figured out that I need to study in a public place with ambient noise, studying with someone else that was studying a different topic, and coffee was available and for sale nearby. So I was so specific that is what I needed to study well and to study most effectively. I knew it in undergrad, so I was ready to study effectively in dental school. So then when I was planning and allocating the amount of time that I needed to study, I had a better idea of how much time I actually needed and how much time, so I wasn't wasting it on social media, email, Netflix, So the biggest thing about managing time in dental school is start good habits now in undergrad. Keep a planner, keep a calendar, keep track of your tests now, color code things now. I'm a big fan of color coding, so each class had its own different color on a calendar, and I would write when my tests were, and I would write study for 5 days before, because I knew it would take me 5 days to fully study, and I would do that for every test. And so I would go home and I'd look at my whiteboard and I'd go through and I would study accordingly. So, those are good habits to start now. Keep a calendar, keep an organized calendar, color code things, figure out how you study, figure out how long it takes you to learn things. And if you've got that figured out in undergrad, you're already 10 steps ahead of everybody in dental school, because you'll know kind of what you need to do to best allocate your time.
Okay, thank you. And then last question, what was your most challenging or memorable case?
In residency?
I guess anytime, in residency.
Most challenging case in dental school, which is also a really great case. I formed a really good relationship with this patient. I did full mouth extractions and alveolar reduction in a patient with multiple sclerosis. And then did a complete denture. And it was very difficult because to do a denture, you have to put somebody into a predictable position. But because this patient had this neurosensory deficit, it was difficult for her to do that. And so I saw her several times. We had a very good relationship. And that's a really memorable case. It was very difficult, but we got it done, and it really changed this patient's life. So that was good. As far as residency, I see crazy stuff all the time. And that's part of the reason why, I made my YouTube channel. I do post crazy cases. So the cysticercosis case of the tapeworm in the lip is crazy. The histoplasmosis case, which is a fungal infection that's really rare, was really crazy. I had a recent case where my boss pulled something out of somebody's palate and we didn't know what it was. So I went to Reddit and I went on the subreddit, "What is this thing?" And Reddit found the answer for us. There is a YouTube video on that. If you want to check that out, I won't spoil it, but I did make a YouTube video about that case. So every day there's just something weird or bizarre or rare or exciting that I get to see. And that's why I love my job, and I'm a huge nerd. So that's I can't pick a favorite, but the histoplasmosis, it is my phone background. So that might be my favorite case under the microscope. I'm a huge nerd.
Okay. Thank you so much, Doctor. Those are all the questions we had. And yeah, we really appreciate your time and all your responses.
Yeah, thanks for having me. Thanks for all the great questions. I appreciate it. Best of luck to everybody. And if you need anything, feel free to reach out. Happy to help out in any way that I can.